When it comes to going to the doctor, men clearly come up short compared to their female counterparts. In fact, according to a year-long study conducted by the Centers for Disease Control and Prevention, women were 33% more likely than men to visit a doctor within 1 year period. In addition, the CDC found that the rate of doctor visits for things like annual examinations and preventive measures was 100% higher for women than it was for men. Why do men hate checking in on the status of their general health so much? Likely for a multitude of reasons. But whatever those might be, not going to the doctor helps explain why there is so much conflicting and often just plain inaccurate information circulating about man's health. So, whether it is for yourself or a man in your life, keep watching to help end this long-standing man's health myths. Baldness comes from your mom's gene. The myth that hair loss comes from your mother's side of the family is still stubbornly hanging around. While male pattern baldness is linked to hereditary reasons, it can be passed down from either side of the family, not just moms. Wearing a hat will make you bald. It kind of makes sense that this myth gained traction. Regularly donning off hats could be seen as cutting your scalp and hair off from fresh air and sunlight, or the hat fabric may be rubbing against your pate, making a bare spot, but no, a hat will not cause baldness. Prostate cancer is the most common form of cancer in men. This common myth is not quite true. According to the American Cancer Society, prostate cancer is the most common cancer in American men except for skin cancers. And you have to get a prostate exam every year. It doesn't have to happen annually, but the ACS recommends that men at average risk of the disease should start getting screened at age 50. For those that are at higher risk, the screening process should start a few years earlier, around age 40 or 45, depending on the level of risk. Eating more protein means you will build more muscle. Protein will only help you build muscle if you are strength training too. According to WebMD, adding more protein but not more calories or exercise to your diet won't help you build more muscle mass. Protein must be consumed after a workout. It's not essential to immediately mix up a big protein shake and slam it right after you get done pumping iron. It's quite the opposite. Strength training athletes should aim to spread their protein intake fairly evenly over meals throughout the day. Cutting calorie means weight loss. Just because you slash your daily calorie intake doesn't mean you will lose weight. Eating fewer calories doesn't necessarily mean eating less food. To be able to cut calories without eating less and feeling hungry, you need to replace some higher calorie foods with foods that are lower in calories and fill you up. In general, these foods contain a lot of water and are high in fiber. Men don't need sunscreen. Guys often feel the need to brush off putting on sunscreen, but skin cancer is most likely to pop up in men. In fact, American Cancer Society says that it is the most common type of cancer found in men, even more so than prostate cancer. Older men are always weaker than younger men. Okay, it is true that your bones will weaken and your muscles will wither as you age, but you can severely delay that loss of vitality by staying active. So keep up consistent exercise routine and don't stop challenging your body no matter your age. More shaving means more hair. It's the idea that more you shave, the thicker and faster your hair will grow back, but this is another false fact based on faulty observations. The hair you are shaving is the dead portion of the hair, so it has no effect on what happens to the living bit underneath the skin. Depression is only for the weak. It's amazing that modern men still cling to the idea that crying and getting depressed is for inferior individuals, but they do, and they are wrong. Depression is a disorder that hits both men and women. Sleeping in helps you catch up from lack of shuteye. You run hard all of the work week, staying at the office late and then hanging out with your buddies, and end up getting about 5 hours of sleep a night. Then the weekend comes and you snooze for 10 hours at a time, thinking it will make up for your weekly loss. Not true. In fact, a Harvard Medical School study says it's nearly impossible to catch up on lost sleep. Favorite foods are not part of a healthy diet. Don't think that just because you've put yourself on a strict new diet to help whittle away your fat belly, that you can't still have some of your favorite junk food. A good weight loss plan includes cheat meals to help you psychologically and physically. Just don't do it more than once a week. You must live at the gym to be healthy. Pressure to be lean and muscular like a movie star or cover model for fitness magazine can be intense for some guys, which leads them to think they've got to be in the gym 7 days a week for hours. But unless your job is a fitness model, to be healthy and strong, you don't have to live at the gym. Squats are bad for you. When done correctly, the squat is one of the best moves for building lower body strength and balance while working your whole body, triggering fat burning and testosterone release. Harvard Medical School even says that the simple squat is one of the most important exercises you can do. Vaccinations are for young men. Many guys think of vaccinations as something for babies or sick people, and generally they are correct, but there are some injections that everyone should be getting regardless of age or gender. Every man snores. Not exactly. Every now and then it's perfectly normal for guys and girls to snore during the night, whether due to clogged airway from allergies or sickness, sleeping position, or just changes in the weather. But persistent and problematic snoring can be a sign of dangerous sleep disorders like sleep apnea, which ups your risk for developing heart disease and high blood pressure. Carbs are bad. You need to eat carbs to keep up your energy levels. In fact, they should be the main source of your body's energy when consumed as part of a healthy diet. This is especially true if you are working out to help you lose weight. You only use 10% of your brain. The granddaddy of all health myths, the idea that you only use 10% of your brain's capacity, has lingered for years, even among some doctors. But there is no evidence or study to give credence to this silly myth, as we know that different parts of your brain are being accessed at all times, and it's an energy hog. The brain is only 3% of our weight, but uses 20% of our energy. And if you enjoyed this video, subscribe, like, and comment.